You're listening to 105.9 The Region. Welcome to Health is Wealth. I'm station manager Tina Cortez, and my co-host from AppleMed is Dr. Mike Carrozza. How are you, your family, your patients? How are you all doing as we continue to navigate the impact of COVID-19 on our lives? Dr. Mike?
Well, Tina, thank you. Everybody's doing well, thank goodness. We're safe here at home. I'm in my home studio. And of course, we're doing this segment as I'm doing pretty much all my office work from home and remotely, and just staying indoors as we're being told. And I think that's the best way right now. I mean, I think we're trying to keep our social distancing. We're doing that. We're keeping ourselves. We're washing our hands. Even our shopping experience now. I don't know about your shopping experience, Tina, but mine is like I'm doing curbside drop-offs by Nature's Emporium. It's so easy. You just go online, you put in your order, and basically they call you. You pay online, and then they just call you when your order's ready, and they say come by this time, and they give you like a window. You go in. You don't even have to wait. It's so amazing, and you just go in and they just put it in your trunk and see you later. So I mean, just the safety, obviously, just to ease everybody's mind and anxiety from going into these grocery stores, because obviously the frontliners, people working there and stuff is a huge stress on everybody. So just one way to relieve stress, I believe, is to do something like this. I mean, there's no extra fee for it. It's easy, and I think it just makes everybody's life a lot easier.
And Dr. Mike, can I ask you, because there is some talk and there's been lots of conversation about the products that you are bringing into your home from wherever you're doing your grocery shopping, whether you go in person, once a week, or you're having it delivered, or you're doing the curbside pickup. If you're doing any of those things, before you bring the items into your house, are you suggesting that we wipe down all the products, that maybe we wash our fruits and vegetables with soap and water before we consume them?
This is a great question, Tina. I appreciate that you asking this. I mean, like I always mention on the shows, I just tell my patients what I do, and I practice pretty much what I preach. It's going to be really hard to find, proper sanitizing things that are going to work. But the best thing that anybody will be able to find is isopropyl alcohol. So you can find that in a spray, or you can just buy it in a liquid, because we know that 70% of isopropyl alcohol will actually kill. And it's interesting because in my practice I do a lot of injections and IVs, and we use a lot of isopropyl alcohol to clean the site before we do an injection, because that 100% kills all bacteria and pretty much all viruses. And so, they've actually some research saying that just spraying your boxes and spraying things down with isopropyl alcohol and leaving it for about 10 minutes will kill anything that's on it, as opposed to like wiping it down, whereas if you're not using the right solution, you could be just contaminating and spreading this thing all around. So yeah, we leave things that we don't have to bring in the house right away in the garage, and we leave it there for a couple of days, and then we just bring in the necessities and spray those down with the isopropyl alcohol, and there you go, just 10 minutes. So good question. And I think like our kids are home right now, and our work is pretty much affected, and some people that are probably even not working at all, or the people that are working from home, I mean, we all have this common stress and anxiety, and we're really, it's pretty much anxiety is at an all-time high right now. And part of this segment is I want to relieve some individuals. I want to first and foremost tell a lot of our listeners to say, hey, you know what? We're here for you. So whatever you need, just contact us, because we'll be here to navigate the waters and help you. But first, I want everybody to understand, let's not panic. Because panic and fear is probably the worst feelings that can actually make things even worse, because these thoughts will trigger, and these panic thoughts will trigger things like cortisol. And cortisol is that sympathetic nervous system that sort of governs our adrenals, and it causes this fight or flight response. And you remember back in the primitive times where there wasn't a lot of food, and there was more the hunter and the gatherer. I'm talking thousands of years ago, or even hundreds of thousands of years ago, and where, when food would come across, when you'd come across some food, you'd probably, hoard it, or you'd probably eat it right there and then, because you didn't know when maybe the next time you were going to come across a lot of food. This is not the case now, but what's happening is this panic is stimulating this cortisol hormone in a lot of our patients and a lot of our listeners. But this is causing hoarding. This is causing our shelves to be empty for the other individuals. So what I want to say is that there's a lot of stock. There's no need to hoard. Get what you need, Shop for just what you need for that week or a week at a time, and just get what you need, because it's this panic that is actually causing us to drive up the stress response, and then we actually get sick from it because we want to stay calm. That's the second thing I want to make everybody understand, is that staying calm, follow the rules, stay in your home, and things like establishing a routine is going to be really instrumental here. You know, this will occupy your time and keep yourself busy, and especially your mind, on what's sort of important. And the most important thing is our health and our family, right? Because health is our greatest wealth. Health is your greatest wealth. I mean, you talk about your assets and what's the greatest asset, it's our health. And right now, Tina, the most important time to focus on our health is now. You know, whether we're working from home, I always instruct a lot of people to stick to that routine. You know, when the kids are home, maybe make their lunches like you were, and then have that snack time like you would otherwise at school, and then make sure you have you time. I think it's really important to put aside that time for walks. Obviously, with that social distancing, keeping yourself separated, unfortunately, by our loved ones, but we still can communicate with them. Okay, and then just getting out for fresh air is crucial. You know, the backyard, doing some gardening, and then certain coping mechanisms to keep your immune systems, healthy is going to be really important as well. Because if you want to coping with your, social distancing, maybe you're not seeing the individuals your loved ones that you normally are supposed to be seeing. But if you keep yourself connected, it doesn't say social disconnection. It's social distancing. It's not social disconnection. So really connecting with your loved ones still is going to be really important. It's going to keep your mental state during this time well balanced. And then how does this cortisol and this stress response affecting us? Well, this hormone is in huge overdrive for everybody, and everybody's just going into the grocery stores. They're sleeping outside. They're trying to just get everything they can, and this hormone is getting pumped up, and it's the fear. And then when this hormone actually gets too high, we don't sleep. And if we don't sleep, then our immune system will not heal itself. So we have to, as a unit, and as Canadians, we have to really work together. And this is where we're going to unite as a force to help one another. So that's not just getting everything in the grocery store that we need, that we just love. Saving something for the other people, because that's what's going to best help every single person in this particular instance. Because, and in ways to sort of quench this cortisol, this issue, is going to be meditation, which is extremely important right now. We need to tap into ourselves. We need to avoid bad news. We need to avoid news. Maybe in general, if you're not a person that can take the news, and maybe you take it too serious, and maybe this is going to trigger your anxiety. So maybe this is not something you should be doing regularly. Ashwagandha, by the way, in terms of herbal medicine, this is an Asian herb. It's a supplement. It's been well documented, well researched to treat anxiety and help people adapt to stress. I love licorice root and rhodiola. But a huge study on the ashwagandha showed, a double-blind and placebo-controlled study showed that taking 125 milligrams of ashwagandha once or twice daily reduced cortisol levels significantly. And that was just for 60 days. So basically, this is the things that we need to do. Obviously the social distancing is extremely important. Hand washing is extremely important. And then just keeping ourselves connected with those we love. I think, Tina, that's important.
Absolutely. Now, what about in terms of dietary choices, and so the foods that maybe we should eat and those that perhaps to avoid at this time?
So mushrooms, they're on the top of my list, because mushrooms heal. They fight cancer, infections, disease. I mean, if you think about the history of mushrooms and fungi and how they came about and how they maybe found out the first antibiotic. I mean, you think about mushrooms as really healthy and balanced. If you have an allergy to them, unfortunately, maybe it's something you should not definitely consume. But mushrooms I love, and I think you should incorporate them as much as you can. Garlic and onions. Use a lot of it. Obviously, only organic. It's really important. That's why we shop at places like Nature's Emporium, to make sure we get those good sources, those organic sources, and even local. Drink plenty of clean water, and from a good source. Limit the alcohol. I know during this time, people at home, maybe they're not working, and maybe alcohol is something that they want to turn to. Not a good idea, because alcohol will actually kill the good bacteria in the stomach lining. And actually, that's going to be a trigger on its own, because alcohol is a trigger to anxiety. So there's a twofold reason to cut it out. Brassica vegetables. Now, these are the broccoli, the Brussels sprouts, and the kale. These are really, really important. Again, the organic ones are going to be important, but they facilitate our detoxification pathway. This is what's going to keep our immune system primed and keep ourselves healthy. And then the foods to avoid, absolute, if you could, 100% is the processed foods. I think processed foods are going to be really, really tough because that, again, lowers the immune system. Canned foods are okay. I don't want to refute things like canned goods because you can get organic canned beans, and it's a good option as well, especially during these times. Cut out the wheat and gluten because that will shut down your immune system. So will the dairy. As well, and this will contribute to things like leaky gut. If you don't have it, you don't want to get it now because that'll make you a little bit more susceptible to infection and viruses. And then avoid things like pesticides and herbicides like glyphosates. And you can do this by shopping organic because, again, these pesticides and herbicides have your immune system sort of under their trap because it sort of lowers your immune system. And always try buying frozen fruits as well, vegetables, I should say. Fruits are great as well, so you can get the frozen blueberries. But the frozen vegetables are really good. The other night I had some frozen beans. They were amazing. So like some string beans. So when you freeze them, they gather them when they're just about ripened. And then they flash freeze them, so it's really still, the nutrients are still there, so when you steam them. And then, so this is the time to take care of your gut, Tina. This is where your immune system starts, your intestinal tract. And so this is where we need to care about our guts more now than ever. So we can't just eat the junk food or just go to our pantry and just munch on a bag of chips. So in terms of, with anxiety being at an all-time high, what can people do at home? So there's cognitive behavioral therapy, and you can just click this on YouTube. You can watch videos. Meditation as well is similar, and so is yoga. Deep breathing exercises are going to be extremely important, and then going for those brisk walks and keeping your social distancing, of course, and then exercising at home. But don't forget about one of the most important things that we need to do is get enough sleep. If we don't sleep, we will get sick. And if we get sick, we can't fend off some of these viruses, and we can't make our immune system strong.
In terms of those listeners, perhaps, who have never meditated before or done a yoga practice, don't exercise a great deal, is this the right time to start?
It's the best time to start right now, Tina, because everybody's got some time. I mean, you can look on some YouTube videos, you can watch some things online. Really important, even deep breathing exercises, just something really simple. We need to get our cortisol. We need to get out of this fight or flight state. It's really the state of mind that puts everybody in a panic. And in this panic state, no good can come out of it because we make irrational decisions. We don't make the best decisions, and we're not at the best in terms of for our family and our loved ones. So I would encourage a lot of people to adopt these principles if you don't already have them.
Now, what about vitamins, Dr. Mike? Can they help in these situations as well?
Absolutely. I think the top of my list is vitamin D. I think the majority of Canadians who are for sure deficient, we know this, the research is out because the cold climate, the lack of going outdoors, we know we are deficient in vitamin D, so it's no use to get tested. But when the time comes, I would like everybody to get tested. They should find out what their levels are. It's important. But supplementation right now is going to be key, especially against this virus and many other infections and immune functions. So probiotics to get your gut in tip-top shape. I like 50 billion or higher. Vitamin A is extremely important to treat and prevent 10,000 IUs. And then vitamin C at 1,000 milligrams minimum is, obviously if you're a child is a lot less, but this is usually what the research shows. And then, there's a lot of studies right now using intravenous vitamin C, and I just read a paper, a research paper that came out of Wuhan, and a lot of the Chinese medical professionals there were using high-dose vitamin C in the office to actually help recover some of these patients. It was phenomenal. They're actually also taking this information and using it right now in New York. So vitamin C is instrumental at priming and keeping the immune system, and in high levels in an intravenous setting is where you can actually start really having that anti-inflammatory-like effect and that virucidal-like effect as well. Quercetin, lots of research on this, very difficult to find, but I just found out a lot of sources, a lot of places have this back in stock. And then melatonin, I just read an amazing study. This is more for sleep and anxiety. For a long time it's been used. This is our pineal gland, which actually doesn't stimulate this, and they're saying that after the age of 40, you start slowing down the production of melatonin. This is an antioxidant. Apparently, this is what the individuals are really suffering for COVID-19, and so they're saying that to help fight and prevent melatonin is a great supplement, and that's usually a dose between 3 to 6 milligrams, depending on what product you have. But that's the latest and the greatest with all the research, and Tina. So I believe those vitamins are the ones that we need right now.
And just before we take our first break, we want to recognize some of our local heroes. Dr. Mike?
Yeah, for sure. We want to thank all our nurses, our doctors, our grocery clerks, and our pharmacists. These are the frontline staff that are making this fight possible and making us have the ability to actually get the supplies we need. And so thank you for doing your job. And, of course, thank you everybody that's taking part in this and helping this fight.
And next on the show, a familiar name.
That's right, Tina. One of our most popular guests is Dr. Fabio Di Stefano. He's going to join us to help us explore the virus, the COVID-19, and pretty much break down how viruses work and how inflammation is a huge factor here. Welcome back, Dr. D.
Thanks for having me. Always a pleasure being with you guys.
Dr. D, so obviously you're safe and working remotely, and so am I. I mean, we're calling in, and so we're practicing our social distancing and whatnot, and so I hope you're keeping well.
Yes, practicing both in clinic because we are still treating emergency patients and at home as well. So it's very important to follow proper guidelines. But again, we're doing our best to stay safe and healthy.
Yes, absolutely, absolutely. I mean, let's break down this virus. I mean, obviously you're huge into the research, as I am as well. And let's break down in terms of, for our listeners, just viruses and what they do. So they're small parasites. They can't reproduce by themselves, and so they infect the host cell. And then so these viruses actually direct other machineries to actually produce more viruses in the human body. So, I mean, they're either RNA or DNA, depending on the strain. But, I mean, the immune system gets attacked, and it causes this huge inflammatory reaction called a cytokine storm. And this is a huge systemic inflammatory response. So, again, we're dealing with inflammation and it being a culprit here. Can you shed some light?
Absolutely. And as you've known from sort of my research and everything that I've been promoting goes back to inflammation. And we now know that inflammation is the root of disease, including viruses like this terrible one known as COVID. As you mentioned, the cytokine storm, the whole process is with whether it's an infection or trauma, our immune system tries to heal it or get rid of it by increasing inflammation. Unfortunately, the inflammatory cycle gets out of control, and the result is more inflammation, more of these cytokines, which are inflammatory cells. And with this condition in particular, when it comes to this viral infection, where it's affecting the respiratory system in the lungs, it's causing a great deal of inflammation and mucus buildup, which in turn hardens and makes it very difficult and challenging for the patient to breathe. So our goal with treatment, as they've been explaining the experts, is to break that inflammatory cycle so it doesn't get to that point of this insane amount of mucus buildup.
Yeah, and so, I mean, the inflammation is a big problem. I mean, it's definitely going to, as it is with a lot of illnesses, but in particularly, I mean, something that they can, I always strongly advise anti-inflammatory diets, but turmeric can really aid in this.
Absolutely, and I'm glad you mentioned the anti-inflammatory diet because, again, we can't do it alone with one thing. But out of all the spices, that are available to us, turmeric has been shown to have very effective antiviral activity. And as we know from previous shows and thousands of studies that turmeric possesses strong anti-inflammatory, antioxidant, antibacterial properties, but now more than ever, its antiviral activity is becoming more known, and fighting diseases or viruses such as your common cold, flu, even HIV, Zika. When I say fight these viruses, there is actually a process, according to studies, how it can potentially stop the entry of the virus, as you mentioned, into the host cell, and thereby preventing replication of the virus and this vicious cycle.
So almost like a defensive, some defense here for our bodies.
Exactly, and it's something that, the problem is that most people are not practicing preventative medicine. And this is something we preach every day, is that you shouldn't wait until the disease arrives. It's always imperative to practice preventative medicine. And even the World Health Organization is saying that it's more important than the cure. And we've known this for years. So if you can build up your immune system and specifically the antiviral activity and the anti-inflammatory cells, you have a better chance of fighting off viruses like this.
And I guess that's the point. I mean, we know that the inflammation cycle here with this particular virus, but not only this, but many other issues, inflammation is a big problem. Mm-hmm. And, things like, I always talk to my patients about how anti-inflammatory diets are going to be instrumental. And I think you said it right. I mean, let's face it. I mean, the prevention, and we said it back in February, and I think you were on my show as well, and we talked about prevention. Prevention is going to be the key for this and many other illnesses that come along this way. And so this prevention happens to be. So inflammation is normal and it's okay, but it's when it gets too much, I believe, that's when it causes a problem, and that's the case. I mean, so Dr. D, maybe you can talk to us a little bit about the uniqueness of how the ultrabioturmeric is different and its uniqueness.
Absolutely, and I'd love to. During my research and while writing my book, The Power of Turmeric, again, we've known for years that turmeric, and even going back thousands of years, and going back to the Indian culture, is that this has been part of their lifestyle for years, and they've shown, again, the effects, the massive effects of it being an anti-inflammatory and antioxidant. But the problem all these years that they've noticed that they know turmeric and curcumin, which is the most active component of turmeric, works, but the known obstacle has been absorption. So what we've done in conjunction with our partner scientists in India is we developed a technology to extract the entire root and not just curcumin, and thereby increasing absorption tenfold and keeping it in the system up to 24 hours, which means it's working around the clock. And so we are the first ones to do that, which essentially unlocks turmeric's full medicinal potential. Now, if we go back to the antiviral activity, again, this is proven. This isn't my opinion, and this is what I've been following, especially now with this crisis, is that, as you mentioned, viruses, in order to survive, they need that whole cell, that living organism. And some studies have shown that the mechanism of curcumin, utilizing this antiviral activity, does that by not only preventing the entry of the virus, but preventing the interaction or binding with the host cell, which inhibits, again, replication, therefore its survival. And that's where we've taken this mechanism and amplified it by adding more bioactives from the root.
And I think that's the key, because keeping it in the system longer versus, you having maybe like a flare-up now, oops, my knee hurts now. I mean, I think the idea is, especially when it comes to this cytokine storm and pretty much all major inflammatory conditions, is that you don't want it just to work now. You need it working around the clock, because, you're going to be hit with this pain on various other instances. And I think keeping it in the system and keeping those inflammatory mediators at bay, I think around the clock, is the key, correct?
Absolutely, and you have your best chance of interrupting the chronic inflammatory cycle if it's in your system at high doses and for longer periods of time. And we know that with any supplement. Researchers, again, they're completely impressed by the effects of curcumin, but they've been scratching their heads because they haven't been able to find something that stays in your bloodstream longer than 4 to 6 hours. That's why they were actually considering doing some studies on IV therapy of curcumin or turmeric. But now we have ultrabioturmeric, which has been proven to last longer than 4 to 6 hours, again, up to 24 hours.
Wonderful.
So we have solved the issue of absorption. And not just anecdotally, but this is proven through blood analysis.
And so, I mean, that's amazing. I mean, a couple quick points. I mean, where can you get it? I mean, here's the problem. I mean, there's a lot of stores that are closed. You can't get it a lot of places. So two questions, like who can take it,
Yep.
and where can people find it?
Well, firstly, so as with any supplement, really pay attention to the cautionary statements. That the nice thing with turmeric is that very little side effects. It does have blood thinning properties, so if anyone's taking blood thinners, they just have to take it with caution or consult their medical doctor. Anyone who has gallstones or has excess stomach acid, they have to be careful because it's been known to do that. But the nice thing with ours, it gets into the system 3 times faster, and it's a slow release as well. So again, during pregnancy or breastfeeding, you also have to. This is contraindicated, and speak to your medical doctor as well. But for the most part, the vast majority of people can take this with very little side effects. Where you can get it, again, as you know, during these times, that this is where we depend on online shopping. You can get it on Amazon.ca and .com, and right now we are an Amazon's top choice product for turmeric. And you can also get it or visit drd'sturmeric.com, which again you'll have a wealth of information there, including the book and the research behind the product.
Wonderful, wonderful. Okay, Dr. D, where can people connect with you?
So you can reach me by email at Dr. DiStefano, so DRDISTEFANO at promedics.ca, and that's PROMEDX.ca.
Wonderful. Well, thank you very much for coming on the show. I appreciate all your research and your dedication to this initiative and many more, and your commitment to your patients.
Thank you very much. Thanks again for having me, and I wish you the best.
Yeah, stay safe, my friend.
All the best.
Thanks, Dr. Mike, and that's our show for this week. If you missed any part of Health is Wealth, go to our website, 1059theregion.com. Thanks for listening.